So much, and I'm so excited to be here virtually. Sad I'm not able to be there in person, um, but I think this is going to be wonderful. This is a very exciting time and a very important time for what FaceBase is bringing to the table. And in my view, FaceBase really is empowering data-driven research to achieve oral health and overall health for all. So as you may be aware, we have a new director at NIH, and among his key priorities are improving population health and curing chronic diseases, making sure research is replicable and generalizable, fostering innovation and embracing new approaches, maintaining high ethical standards, restoring public trust in science, and critical to all of these are data. Data is central here. One significant initiative is the Real World Data Initiative that he is spearheading. And this platform is an initiative to link many different data types beyond the biological that we often think of in the omics, but including electronic health records, claims, pharmacy data, mortality data, biosensors, and others. And what a wonderful opportunity for federated data to interact potentially here and answer questions that are critical to the health of our nation. If we look at the NIH strategic plan for data science, it's focused on improving capabilities to sustain data management and sharing, developing programs to enhance human-derived data for research. Much of that is now housed in FaceBase, providing opportunities for software, computational methods, and AI, as well as a federated biomedical research data infrastructure, which FaceBase lends to, and importantly, strengthening a broad community in data science like this one. Data science is really key to advancing all of our strategic priorities at NIDCR, making sure we can really move things through data-driven solutions to promote oral and craniofacial health and overall health by increasing data diversity and improving our tools while we nurture future investigators and health professionals. We've made significant investments in data science research, and really it's ubiquitous now. Data science is research, irrespective of what field you're coming from. But when we look at data reuse, and many of them employing AI and ML approaches, we funded more than 90 awards in this space. And if we look at what's coming up, right, approved concepts, data science is critical to all of them. Advancing precision imaging for enhanced diagnosis and treatment of oral lesions, modulating the microbiome towards health, community engaged research to advance oral health intervention methods. And here we're working with the SHARE platform that NIMHD has stood up, focused on artificial intelligence bias reduction. The digital twins concept that's focused on advancing innovation and optimizing clinical outcomes in dental, oral, and craniofacial medicine. And finally, the primary care, dental primary care, PBRN, practice-based network to support research in clinical practices. That concept is focused on medical dental integration, which will require integration of the health records. Data is central to where we are and where we're moving. We can't be the guy on the left here with the data is unorganized or poor decisions, what have you. We need to be the person on the right and have a DOC data infrastructure that's capable of cross collaboration, that's modernized, that's a place where we have data that is ready to go for analytics and we're able to optimize visualization. And we can use this to help our workforce. But importantly, make sure that we're promoting data stewardship and good, sustainable policies. Okay? So here's FaceBase. You guys are trusted and NIH affiliated, focused on FAIR principles. The data is citable, which is a huge win. It's visual and linked data, 2D and 3D. You can annotate your images, you provide hands-on support, and there's flexible data embargo. All of these things are wins for the community. And so important now as we grow and collaborate with NIDCR and ODSS, that we are really providing the self-curation opportunities from conceptualization to the data being ingested, stored, used, preserved, appraised, and going back and forth across this continuum. And that is what is critical for curation, but teaching people how to do it themselves is a huge value to the field. And you already talked about this hybrid approach, so I'm not going to dwell on it, but the flexibility across experiment types and opportunities for scalability across both specialized and generalist repositories is wonderful. Now, you've talked a bit about your history, but the bottom line is with the goal of delivering state-of-the-art scientific data sharing and accelerating data-driven science. And let me just applaud you right now on this core trust seal certification that I think was acquired over this past year and is a huge win for the community and for FaceBase. So congratulations on that. Okay. When we think about the goals of NIDCR and where FaceBase sits as we move along the continuum of moving to improved health, we're starting with CDEs that are community-driven and NIH endorsed and working across our full dental, oral, and craniofacial community to make sure that we have CDEs that are core CDEs and custom CDEs. And we'll be moving towards all of the different areas where we're in, having these and getting them NIH endorsed. Now we'll have harmonizable data that will be collected and hopefully self-curated and AI ML ready. And this is what FaceBase is bringing to the table, which is so critical across the full life cycle of a project. Before people actually even apply for their awards, opportunities at the pre-award phase to include FaceBase in their data management and sharing, submitting, once the grant is ready to go, submitting the data to FaceBase throughout data collection, and then uploading the metadata once the project is complete. So critical. Now it's ready for analysis. The opportunity to bring these data together with other data sets and different data types, perhaps utilizing cloud-based analytics that were available through the D.D.S. hub. So take an opportunity to look at this data-driven science hub. It's an important centralized resource that we have at NIDCR that guides investigators to data, biospecimens, and other materials and resources, so that what's coming from FaceBase may be able to talk with data coming from other repositories, and we can then generate new data, new information for the field to expand the science and to improve health. And there are significant opportunities to bring these federated data sources together and answer really important questions. And I'll be across our field, right? We can take data sets, data from cardiovascular studies and from hearing studies, where we know that there are shared developmental syndromes with what we see in craniofacial, and bring those together. We can look at broader cancers together with data we're bringing in from oral cancer to look at shared pathways and etiologies, looking at metabolic disorders and periodontal disease and oral inflammation, which shifts the inflammatory landscape, and look at shared mechanisms and additive consequences. There are so many things to look at, the whole body physiome, and then salivary physiology and exocrine biology, and understand shared processes and interactions. And then, of course, looking at medical conditions and factors of daily life, together with oral health status, to look at overall health and well-being in others. So really, it's bringing the mouth together with the rest of the body and the conditions of daily life and the environment and all of this data to get us to health and wellness for everyone. Significant opportunities as I look at the summary of data where you are, over 1,000 data sets, over 3,000 experiments, and over 56,000 files with multiple species and multiple different data sets based on the methods in which they were created. And as we look at opportunities for secondary data analyses, we have the small grants for oral health data analysis. Those are due in 2 weeks. We also have the small research grants for analysis of existing genomics data, the R03, and also the R01 due this week. There's an upcoming opportunity called Primed AI, and this is a Common Fund's precision medicine with AI, integrating imaging with multimodal data. This is already happening in the context of FaceBase. So this program is going to combine clinical imaging with other types of health data to develop innovative AI-powered clinical decision support tools to enable new personalized medicine strategies. There's going to be 4 foundational components, combining imaging and non-imaging data, which is happening at FaceBase, developing AI tools, implementing those tools in the clinic, and importantly, building trust and coordination among researchers, clinicians, and patients. So primed AI funding opportunities are expected to be announced starting in this summer 2025. I'm so excited about the cross-NIH collaborations. Of course, we've already heard about ODSS and NIDCR, which is wonderful, working to increase AI readiness, fairness, and trustworthiness of data, and making sure that we're considering ethics in data sharing and reuse. Importantly, making sure that we're delivering state-of-the-art services to all of our contributors and users, and integrating with resources and data from other biological domains, like the DCD project with temporal bone and other NIH-wide programs like HEAL. I think this is just the beginning for us, okay? And there are wonderful opportunities. So cheers to a wonderful meeting, to helping to promote data-driven science for the field and for your service to the community. There've been, now we're on 16 years and close to 300 publications, taking advantage of data crowdsourcing and self-curation, built-in flexibility and scalability, and significant opportunities to move things forward. So wishes for a wonderful and successful meeting and an informative one where we'll learn a great deal. Thank you so much.